Welcome to the AMC MCQ course for Img Sos. This is Introduction Module, Lesson 5. And in today's lesson, we're going to talk a bit about the context of Australian health. This is part of a two-part lesson. In Lesson 5, we'll talk about the context and a bit about the Australian people, what makes up the population and how that impacts on health. In Lesson 6, we're going to talk about the actual system, about health economics, and about the structure and system of Australian health. So let's start talking about some people. Through this video, you can pause at any time, feel free to write notes if need be, and of course save up any questions you may have. At the end of this introduction module, there will be a discussion forum, and it's a great place to ask your questions if anything isn't clear. So let's get moving. One of the first things that's important before we move into the way the Australian health system is structured is to actually understand background about Australia. If you know a little bit about the population of Australia and about the way things are structured, about who makes up the people and how we function as an economy, it actually makes the health system a little easier to understand. It helps to understand a bit about the demographics of the people to help you understand the country and the way health is delivered. We're a large country with a relatively small population. Australia is about the same size as the United States of America, give or take. However, our population is only 10% of theirs, a bit less than in fact. With a population of 23 million people spread across a large nation, that in itself has its own health challenges applied to it. We're a population that has a large proportion of migrants and their descendants. 27% of the population were born overseas. If you consider, though, of people born in Australia, how many have parents that are born overseas, first-generation Australians, or people whose grandparents were born overseas, second-generation Australians, you're then looking at more than half the population. We're a relatively young nation as far as government is concerned, although, and we'll talk about it later, we're actually an ancient nation as far as our Indigenous population is concerned. 3% of the population are Indigenous Australians, that is, Aboriginal and Torres Strait Islander people, and that makes up about 670,000 people all up. Our population is ageing. Over the last 30 years, the number of people over the age of 65 has tripled, and the number of people over the age of 85 has increased sixfold. This is partly due to general population ageing, lowering birth rates at the younger end of the population spectrum, and also increasing lifespans, decreasing mortalities, and increasing health for elderly people. This is a phenomenon many Western countries are also tackling. So what that means is that the median age of an Australian is now 38 years of age. Doesn't sound very old, except the median age of an Australian in 1989 was only 31 years of age. That's quite a large jump in a relatively short period of time. The Indigenous population, however, is much younger. The median age for an Indigenous Australian is 22. Now, there's a few reasons for that. Part of it is increased fertility in young Indigenous people, but sadly, the major reason for that age discrepancy is because of the mortality gap. The age of death at Indigenous Australians is significantly lower, and the life expectancy and health outcomes for Indigenous Australians are significantly lower. And we'll talk about that a little bit later on. I mentioned that we were a large country with a small population, but we're also a highly urbanised country. So not only do we not have a lot of people, but those people are concentrated around the coastal fringe. 70% of Australians live in major cities and 27% live in regional areas, with a large proportion in the southeast corner, the Sydney, Melbourne, Brisbane corner. Only 3% of Australians live in remote areas. So to explain that to you, in Sydney, the population density is more than 13,500 people per square kilometre. In Central Australia, our population density is less than 1 person per square kilometre. In the Northern Territory, for example, there are more cattle and more camels than there are people. All of this provides quite significant challenges when it comes to delivering a health system, and we'll talk about some of those. One of the other issues in remote areas, apart from just distance, is that remote areas are disproportionately populated by Indigenous Australians. So more Indigenous people live in urban areas and in New South Wales than anywhere else. Sydney is our biggest city, New South Wales is our most populous state, so it's not surprising that there's more Aboriginal and Torres Strait Islander people there than anywhere else. However, when it comes to the small remote communities, almost half of those remote communities are Aboriginal people. So that changes the health needs of those remote communities and also the health access issues of those communities as well. As far as economics are concerned, Australia is the 12th wealthiest country in the world based on GDP and is climbing in that regard. We are a relatively wealthy country and escaped from the global financial crisis relatively unscathed. All countries got a bit of a hit from this, but we certainly didn't have the significant effects that other Western countries did. Our unemployment rates are relatively low, our inflation rates and interest rates are relatively low. We are a relatively stable economy. Our health expenditure is $140 billion a year, roughly, which is 9.5% of GDP. That ranks us 5th as far as the OECD. Now, importantly, that has doubled in the last 10 years. This is where the ageing population and the increased costs of healthcare is really obvious. Of this $140 billion, about 70% is funded by government, with the remaining 30% funded by a combination of patients, private health insurance and compensation and accident schemes. We have a strong primary care focus, and we'll talk in our second lesson about what that means for the delivery and the success of healthcare in Australia. But about 38% of our funding is actually spent on primary care and about 40% spent on hospitals, with the rest spent on other programs. So that's quite significant. In countries such as the US, and I use the US as an example because it's one of the countries that's probably the most different to us as far as health economics is concerned, they would not have the same proportion almost of money spent on primary care and hospitals. Let's have a talk about health outcomes. We've just briefly touched on the health economics and we'll talk about that. But what are the outcomes? Before we describe how the system is set up, does the system work? Are we a healthy country? One of the important take-home messages is that the Australian level of health continues to improve overall. The life expectancy for men that were born today is at 79.9 and of women is 84.3, and these are climbing. Death rates are falling from cancer. They've fallen 17% in a decade. Death rates are falling from heart disease, from COPD, from asthma and from injuries. 55% of Australians describe themselves as in very good or excellent health. So as far as countries go, we're actually doing okay. But, and I think we need to remember, this is a snapshot. There are a few areas where we're doing very badly. 63% of Australian adults are overweight or obese, and this has increased from 57% in 1995. It's climbing almost exponentially, and there is an expectation that within the next 10 years, almost 80% of the population will be overweight or obese. And as you know, that has significant health impacts. The other thing is that this health picture that I'm describing here with these mortality and survival rates is for all Australians. If you separate out the health picture for Aboriginal and Torres Strait Islander people, the outcomes are much, much different. And we'll talk about them in detail, but I think it's important to know that overall we're doing okay, but some pockets of the population are not doing well at all. Also, that overall picture looks at all Australians, and as we said, most of us live in the coastal fringe. Most Australians live within 50 kilometres of the coast. But if you look at Australians in regional and remote areas, they tend to have shorter lives, they have higher rates of disease and injury than those living in major cities. This is not a uniquely Australian phenomenon. In countries with large rural areas such as Canada and the USA, they see similar pictures as well as far as health is concerned. Delivering health to rural communities is a challenge for every Western country. So let's talk a bit more about rural health. Australians living in remote or very remote areas, on average, have higher rates of risky health behaviours, they have poorer access to health services, and they have worse health than people living in regional or metropolitan areas. It's quite simple. Basically, the distance you are from the city is a major determining factor of your health. Your mortality and illness levels increase with distance from cities. Your death rates from all causes are higher. and people in regional and rural and remote areas are more likely to suffer from coronary heart disease, asthma and diabetes, among other diseases. The health needs are more complex. If you're looking at deaths per 1,000 population, you can see on this graph how the deaths per 1,000 population increases in regards to remoteness. More people die the further out you are. Even though the population is much smaller, the death per 1,000 is much higher. Deaths of males in road accidents is 100% higher in remote areas. For young men, suicide rates in remote areas are double the rate in cities. So this is a significant issue, and this is just two factors that I've pulled out. The rates in all areas are significantly higher. Which brings us to the question why. Looking at this family sitting on their farm, why is this family significantly more likely to have health problems, health issues, and all of these rates of illness and death that we've described than the same family that might live in Sydney or Melbourne? You might want to pause the video for a moment and have a think about why that might be. It comes back to social determinants of health. Obviously, people think, well, part of it is their access to health services. And yes, the first point here is less access to health services, and they need to travel greater distances to seek medical attention. If your nearest doctor is 50 kilometres away, or your nearest hospital is 200 kilometres away, if you have one at all, obviously you're going to delay seeking treatment, both in an acute and a chronic sense, and you may be less likely to actually seek care for conditions. So patients end up with higher rates of complications, lower rates of diagnosis, poorer management of chronic disease. But there are other issues that aren't just fixed by more access to healthcare. There are overall higher rates of ill health and mortality. People in rural areas suffer from educational disadvantage. School opportunities are less. Employment opportunities are less. Even simple things like household income is lower in remote communities than it is in regional communities, and it's lower in regional communities than it is in cities. So the populations have less disposable income, less education opportunities, less employment opportunities, all of which impacts on health independent of their access to medical care. Finally, people in rural areas are working in areas with more occupational and physical risks. They're often working in machinery, they're often working on farms, they're working in extreme conditions. People are driving long distances on poor quality roads and often are speeding. All of these different factors increase the risk of health independent of their access to health services. Other thing that happens in rural and regional communities is health risk factors and high risk behaviours increase. So if you actually look at smoking, overweight and obesity, decreased physical activity, alcohol and high blood cholesterol, all of them are higher in regional and remote communities than they are in major cities. So patients in major cities undertake less risky behaviours or less health risk behaviours, as well as having more access to healthcare, less problems with access, less distance to travel and less risky environments. So this just complicates everything. Now, in that way, we're just looking at Australians in general. If we actually look specifically at Aboriginal and Torres Strait Islander Australians, Indigenous people are less healthy overall. They die at much younger ages, they have more disability and lower quality of life. And this impacts no matter where they are. So Indigenous people living in the city have worse health than anybody else in their area. And Indigenous people that also live in remote communities have the double whammy of being remote and having difficulty with access, as well as all the social and health factors that comes with being Indigenous. So the health problems can be quite dire. Statistically, we're looking at a mortality gap of around 10 to 17 years. There's some question about the accuracy of that data, and it may be an underestimate. Some evidence puts it closer to 20 years. So meaning that the life expectancy for an Aboriginal Australian is up to 20 years less than a white Australian in the same circumstances. That's quite appalling. Death rates in the 35 to 44 year age group, which is where we shouldn't be expecting people to die, is 5 times the rate of non-Indigenous Australians. Aboriginal and Torres Strait Islander people have 7 times the rate of end-stage kidney disease, 3 times the rate of type 2 diabetes. They are 10 times more likely to die from their diabetes should they have it. The rate of youth suicide is 4 to 6 times that of white Australians, and they're 3 times more likely to be hospitalised with respiratory disease. There are other significant social factors as well. Again, when we're thinking about Indigenous people, why? Why is the health problem so significantly worse for these people than it is for white Australians living in the same circumstance? It's about disadvantage. It's again about social determinant factors. Now, we'll be talking a lot more about this when we get to Module 12 at the end of our sessions when we talk about population health. But just to give you a touch right now, if we're looking at Aboriginal and Torres Strait Islander people across Australia, the smoking rates are double. 41% of Indigenous people smoke. Obesity rates are 1.5 times higher. The average unemployment rate in Australia runs around 5%, but 17% of Aboriginal and Torres Strait Islander people are unemployed. Across the country, youth income for Indigenous youths is $300 a week less. That's a significant difference. Homelessness is 14 times higher. NAPLAN, which is a national test for literacy and numeracy done at primary school, NAPLAN in all states is lower for Indigenous children. So Indigenous children have less proficiency in numeracy and literacy no matter where they are. 81% of Australians complete grade 12, the final year of high school, only 47% of Aboriginal children. And when it comes to holding a bachelor's degree in any field, around 14% of Australians hold a bachelor's degree, only 3% of Aboriginal people hold a bachelor's degree. So the educational disadvantage is strong. On this slide, I haven't discussed things like crime and incarceration, but Aboriginal people are very, very heavily overpopulated in our prison system, which leads to lifelong difficulties, again, with employment, education and income. Things I think is important to think about is social determinants of health. Often in medical school, we're trained to think that we change things as doctors, so that we are the ones that are responsible, obviously, for bringing health, and maybe if there was just more doctors, everything would be better. What this slide shows us, it's much more complex than that. So if you're looking at remote communities, only 43% of their health issues or their health problems are related to access to health services. The majority of their issues are to do with the social determinants of health that we've discussed: education, employment, genetics, family history, health literacy, things like that. Behavioural risk factors such as smoking or obesity or exercise, and the interaction between the two. If you actually look at those things, they make up the majority of the issues. So we could put a whole lot more doctors in a rural area. We may not be able to solve the health issues simply by putting more doctors. It's far more complex than that. So how does it all work? With that in mind, what I hope to explain in this lesson was about who the people are that we need to deliver healthcare to. What are some of the challenges you can see immediately? What are some of the problems that we need to overcome? Distance, social determinants of health, access to care, the difference between health issues for white Australians and Indigenous Australians, also not including all the other cultural and language and access issues for Australians from other cultures. Lots of complexity. So in Lesson 6, we're going to go into far more detail about the way health is delivered and the way healthcare is structured in Australia to help you understand. If you've got any questions from this session, write them down, because we're going to have opportunity at the end of the module to discuss them all in our discussion forum. I hope you've enjoyed this. Let's roll on to Session 6.